Gambling is very much so. I actually had a nursing instructor when I was in nursing school. Her husband had a major gambling addiction. She had no idea. He told her he went to work every day, and he was literally going to the casino every day and blew through their whole savings, their kids' college fund, cashed out IRAs. They had blew through all of their retirement, and she divorced him over it because he literally left her with pennies. And she found out when the bank called her and said your house is getting foreclosed on. She thought her husband had a very good job. He always dealt with the finances. She had no clue. He literally was blowing every penny they had on gambling, and was insane amount of money in debt. So gambling can be a huge thing. We don't always think of it as addiction. What are some other addictions that doesn't always have to be a substance? Those are the big ones. What? Phone. Screen addiction, especially with kids. You guys heard that lady say at the Child Expo, you take a kid's device away from them, and it's like you're taking a drug away. They're literally addicted. So any psychological or physical need for a substance or a process, right? So screen time, gambling, those can be processes. There's sex addicts out there, addicted to porn, addicted to sex. There's workaholics, right? That people have unhealthy habits because they truly just work. So different types. It interrupts their day-to-day life. It can be put their life into danger. Tolerance. So what does tolerance mean? If you put enough of something in your body, you're going to build a tolerance to it, right? So if you have somebody who's addicted to opioids, they're going to have to keep increasing how many they get to increase their high, right? Same with alcohol. Or maybe you guys never drank till you were 21, right? And then you had your first drink and you were tipsy. And then the next time you maybe had a couple more and you were able to tolerate it. You build this tolerance, right? That's what tolerance means. If people come dependent on it, you're dependent on something, you can't function without it, right? So you have this strong need for a substance or whatever the addiction is. And those people will do whatever it takes to get it, whether that is hurting relationships, hurting themselves, hurting other people, financially hurting themselves. So addiction can be very hard on not only the person that it's affecting, but their whole entire family unit or anyone they have close to them. So people with true addiction tend to burn a lot of bridges. Any of you know anyone who are true addicts? Nobody? None of you know true addicts? No?
I guess there's a lady in my town, well, she doesn't live in Tyndall, but she comes to the hospital once it hits winter time. Every day in the ER, specifically asking for Dilaudid.
So why do you think it's in the winter?
Because she's depressed, but then the sad thing, the scary thing is she's a nurse at a nursing home in town. So then it's is she taking their stuff, or why is she taking Dilaudid?
So let me ask you guys this. Who do you think is most prone to addiction? Older people, you think? Do you think the chemistry in your brain has anything to do with addiction? Some people are wired to where they've done a lot of research on this, that people who truly have an addiction, their brains are just wired differently. They have different neurotransmitters, or where whatever it is, they get a little bit of that drug or substance or whatever, they get this huge rush of dopamine versus, so you have a person who is an addict, maybe they have addiction in their family, maybe they grew up with it, maybe it was a very social norm for their culture. Maybe on Sundays they went to church and then they went to lunch and they drank at lunch, they drank in the afternoon, that was just part of their culture. Some people are like that, right? Every time there's a meal, there's drinks in front of them of some sort of alcohol or wine or whatever, and it just becomes very much a part of how they grow up. And maybe at a certain age, there's people as young as 9, 10-year-old here have a drink. If you drink with a family, it's safe. To them, it's safe, whether they're 9 or whether they're 20. But some families just believe it's very much part of their culture and it's safe, right? And if you teach them to drink young, they'll be safe with it. But every time they get a little bit of that, we know what? It stimulates that dopamine in their brain. So eventually, if they have a true addictive behavior, they have to keep getting it until their tolerance is so high and they become dependent that it starts to take over their life. So it can be recreational. Some people use it to try to modify or to mask mood or behavior disorders. So a lot of people who struggle from addiction are truly suffering from something else. So maybe it's a Band-Aid that they're trying to cover up with something, right? We all are like, oh, I'm stressed, I need a beer. Or, hey, that was really stressful, I'm gonna go have my vape or smoke or whatever. And then these people who, it increases their dopamine so much, and then they need more and more and more, and then what happens when that substance doesn't give them that high anymore, then they might turn to mixing substances, right? Well, maybe I'll have a drink and throw some pills in with it, or maybe I've done marijuana for a while and now that doesn't do anything for me, so now I have to do something stronger, meth, or mix opioids, or mix benzos in. So when it becomes to, they just need more and more and more. Yeah, Xanax, benzos, whatever, lorazepam. So again, sometimes our social culture can tie into this chemical use, right? Especially you'll see this sometimes in the Native American population, and that's not being stereotypical of them. There's tons and tons of research that we know that the way they grow up, the way their culture is, they are more prone to being addicted, especially to alcohol. And they tend to go towards alcoholism. It's a very big part of their culture. They grew up with it, and a lot of them become very addicted. So it can become other things like narcotics, sedatives, stimulants, hallucinogens. We're going to talk about kind of all these different things. So what the intoxication looks like, what the withdrawal looks like, and then what we're going to do about it as nurses. A lot of these substances are used illegally. So again, any substance in excess dependence, so they can't live without it. They need the substance or they'll start to withdraw. So there's a lot of times when people are addicted to something, and it's not necessarily that they like that constant feeling of being high. It's they can't stand how they feel when they're starting to withdraw. Like the withdrawal symptoms are really, really hard for them to go through, or maybe they started their addiction because they had some major depression or major anxiety, and then guess what happens when they start coming off of that drug or off of that substance? Or you guys do drink and you're hungover, how do you feel? Awful, right? So sometimes it's the feeling of withdrawal is so bad that they have to keep using to try to prevent that horrible coming off of it. So that's kind of the kindling effect. So this is when you have long-term changes in your brain, or you start to dampen those neurotransmitters to where normal things that would give them joy, it doesn't give them joy anymore. So then they just have to go back to whatever the substance is that is trying to stimulate those neurotransmitters. And eventually, they become so dampened that nothing works, right? So that's kindling, when there's issues happening in the brain because of their addiction. So other forms of addiction, we kind of already hit on these. Shopping, we didn't say. Anyone have a shopping addiction? Amazon's at your door every day. Cutting. So sometimes in adolescence with depression, anxiety, or whatever, they'll start to cut themselves as a way to like release tension or release anxiety, release their mood, or sometimes it's like a call for help. So there can be people that self-harm, and for whatever reason they get like satisfaction out of that. Pornography, you guys heard that lady say that as early as age 9, kids are exposed to pornography on the World Wide Web. Very, very scary, right? After she talked, I wanted to go home and burn my kids' iPads. And I feel like I monitor them pretty well, but I was like, well, we need to just burn these things. Let's go back to the Stone Age and no technology. Spending, internet, or other type of gaming, right? Any gamers in here? Addiction. I have friends who their husband will stay up like till 4 in the morning, like gaming, all the time. It can be an addiction. It does the same thing for a brain, right? It's something they enjoy. So I don't know, maybe they're winning their game, it releases a little dopamine, right? Same kind of thing. Eating disorders can also be a form of addiction, which I already talked about that. A form of like self-mutilation, it becomes an addiction, they become very addicted. So here kind of describes kind of addiction and how it affects each part. So socioculture, so if they grew up in a difficult environment, so abuse, neglect, trauma, maybe there's a reason that they turn to whatever they're abusing, or using, I should say. Negative peer influences, so peer pressure, right? How many of you can say that at some point in your life you have been pressured to use something that you wouldn't have normally done by yourself? Doesn't have to be drugs, alcohol, anything. Peer pressure is a very big thing. I'm sure all of you have at some point been pressured to do maybe something, right? So negative peer influences, maybe you are the influencer, maybe you're the enabler. It's like, come on, it's just one shot, just 2 shots, just 6 shots later, you'll be fine. Hopefully not, right? Psychological influences, so lack of sense of purpose, so maybe they have some underlying depression, anxiety, mood disorder, disorganized thoughts, not great self-esteem, significant stress. There's some research out there that says in 2020, people over the age of 50 had a lot more issues with addiction. It used to be more seen in younger people, and now it's starting to be seen in older people. Sometimes maybe they're not where they wanted to be in their life, or they're going through a midlife crisis, or their job is very stressful. We live in a very different world where it's not always what it used to be. So a lot of stresses that happen at different points in life, right, could lead them to addiction or turning to something bad. Psychological disorders, like anxiety, depression, we already kind of talked about that. And then biological. So is there genetic influence within their family? If people in the family have true addiction, there is a great chance that they'll pass that down. Their brains are wired to be more prone to getting dependent on a substance, or having a higher tolerance, or it's turning into more of an addiction. So sometimes we start to see it in adolescence, or when they start to receive peer pressure from their friends, like, hey, just try this vape, just try this smoke, like, hey, let's sneak down to my parents' basement and steal some beer out of their fridge, or steal some liquor out of their liquor cabinet, right? It starts in adolescence, then maybe they like it, they like how it makes them feel, or if their brain has this kind of addictive behavior, they're going to want more. So sometimes it starts very young, and then they'll do whatever it takes to continue to get it. Sometimes they do it out of frustration, stress, developmental stresses. Maybe they feel like, well, if I drink with my friends, then they'll think I'm cool. Or if I try this, then, right, that peer pressure. They can have a tendency towards anxiety, anger, low self-esteem. So again, some other sort of mood disorder, maybe underlying depression, anxiety, maybe they don't fit in, bullying. There's been a lot of research around addiction and bullying. Would have been a great research topic for you guys. Should have thought of that earlier. Because truly, when does the adolescent brain develop? When is your frontal lobe fully developed? I don't know. Around 26. It used to be 26 was the age they said your frontal lobe is fully developed at age 26. So what is your frontal lobe responsible for? Thinking, memory, problem solving, critical thinking, right? So adolescents, around teenage years, their brain isn't always able to make critical decisions. They're not able to problem solve, right? Any of you been around teenagers? This is very true, right? They sometimes don't have this rational thought, or like, what is the next step? So if we start interrupting or disrupting the neurotransmitters and their overall function very early on, it's obviously going to lead to a lot of problems down the road, especially if we create an addicted brain that early. So those who are addicted or abuse substances have a lot higher rates of mental health disorders than the general population. Sometimes I don't know if it's, did they have a mental disorder that led them down that path to start abusing, or the fact that they're addicted, did that cause some of these mood problems to come out? There really isn't anything that dead set. They know that people who are more prone to depression, anxiety, and if they get involved with drugs, alcohol, those things might be more likely to continue to abuse or to become addicted. It affects the whole family, very much risk of social isolation. It can affect their overall social support system. Sometimes the family can become enabling of the addiction, or maybe they want to try to cover it up, right? Or they don't want to burn that relationship, so they don't think it's as bad as it is. So a lot of times the family can be an enabler, or can almost be codependent, which we'll talk about in a little bit. A lot of times the addict is going to be in major denial, so they might drink in private, or hide the amount that they do, or really admit to how much they truly do. So it really is a family problem. If they are abusing substances when they're pregnant, we'll talk about that a little bit later. Children can carry those effects into adulthood. Or if children come from families where their parents are completely addicted and they see them passed out every day when they get up and go to school, like how does that affect their overall upbringing, right? They're truly raising themselves. It happens all the time. I don't know if any of you guys went to the older lady at that Child Safety Expo. She talked about like addiction on the children and how it affects them. And she told a story of there was an addict and his kind of rock bottom moment where he decided he wasn't going to do it. He was at a party high and there was a baby crawling to him on the floor. Some of you guys were in that with me. And he picked up the baby and it like reeked because it probably hadn't had his diaper changed in who knows how long. And that was like his wake up moment of like, who's raising this child? Like it wasn't even his child. So at that point he was gonna get clean. Then he actually got arrested, ended up in prison. But that was kind of his like breaking point of, wow, like I hit rock bottom. Like nobody is caring for this baby that's crawling around, probably eating remnants of drugs off the carpet because no one else is feeding it anything. So it very much affects the whole entire family, affects children as how they grow up. A lot of kids in the foster home system is because their parents are abusers, they're on meth, they're on drugs, they physically can't take care of them or mentally can't take care of that kid because of addiction. So it is a huge problem. They don't develop any sort of communication patterns. Their brain does not develop right. They have very enabling behaviors. It affects them long term, and then very dysfunctional family roles. Okay, a lot of them can become codependent. So what does that mean? If somebody's codependent, what does that mean? They rely on other people for everything. So sometimes people of addicts, their family can be very codependent of them. So they might become enablers, or they might make excuses. So for example, if their spouse was not showing up for work or always calling in sick, they might make up some elaborate story for him of like, oh no, he's not an addict, he's just suffering from some major illness or something, right? That's being codependent to the person who's struggling with the addiction. They're enabling them to continue a behavior. And sometimes it can be the person who's an addict themselves. They have feelings of guilt. They have trouble saying no, fear of being alone. They always have this like victim mentality, right? So if any one of you have seen movies with addicts in there, very much like a victim mentality, right? Like poor me. Their self-esteem is very poor. If you choose to drink your breakfast in the morning or shoot up your lunch, instead of have a job, have family relationships, take care of your own children, do things that were once important to you, very much a victim mentality, right? Like it's poor me. It's not always their problem. They always think it's somebody else's problem. That's like codependency. So how are we going to assess them as a nurse? How do you deal with people who have a true addiction? What do you guys think? How are you going to build a trusting nurse-client relationship with somebody who's addicted? What? Don't judge them. That's very important not to judge them. How do we know if somebody's addicted? How would you guys know in the clinical setting? Are they gonna admit it and say, hey, I'm an addict? When they check in, say, hey, I'm gonna start detoxing in 2 days, so you better be prepared? Probably not. They're gonna wanna try to hide it, right? So it might be a case where you're taking care of somebody and all of a sudden they have a major mood change or major change in their behavior, and then we gotta question, okay, have you abused any substance recently? Sometimes we know by their chart. Do we, in our assessment, when we do an admission paperwork, admit people to the hospital, how many of you have been in on an admission? Hospital admission, a couple of you. Or like on a health history, do we ask about, do they drink, or how often, or do they abuse any substances? We do, but if somebody truly is an addict, are they going to rightfully admit that? So is there a better way to ask that question?
How often do you smoke? Like, just ask them straight out, 'cause that's what that lady said too, and that other lady, she said, don't ask like that, just ask, like, assume they do it, so just ask them like,
Right.
how much do you drink, or like, how many packs of cigarettes do you smoke?
Yeah, so
they
she
have
said
to-
she always asks them, like, if she knows that they abuse, she says, oh, do you drink 50 beers a day? So she does it to the opposite extreme, because we've always been kind of taught to say, how much do you drink a day? They're not gonna tell us honestly, right? Or how much crack do you use a day? How much heroin do you use? They're not gonna tell us, right? But if we know they have a problem, you might say, you drink a 12-pack a day. Oh no, I only have 6 beers. There you go. It used to be we just said, how much you drink a day, and they'd say, I drink 6 beers a day, and then we were told to times that they probably only tell us half of what they do. Maybe they're completely honest, and they truly only drink 6 beers a day. So that lady who dealt with this and did a lot of drug and alcohol counseling, she said she would always like exaggerate it, like, oh, I bet you drink 120 beers a day. No, I only drink 100. There you go. Then they're more honest with you. So I think that's a very good tool to keep with you guys, especially if you're in the ER and someone comes in and it's like, not like, oh gosh, what did you take? Like you're high as a kite, but maybe, did you drink 50 drinks tonight? No, I only had 12 and 3 shots. Okay, well there you go. Then you know exactly what they had. Involve their family members. So what kind of assessment or what kind of nursing things would you want to ask their family if you're dealing with somebody who's addicted? What would be important to know? Family history. So how long has this behavior gone on for? Have they ever tried to get any sort of treatment? What has worked for them in the past? Is it getting worse? Do you notice their behavior getting worse? Do you notice that they need the substance more? Do they have a job? That can tell a lot. Like if a person can go to work and function, there's a lot of very high functioning alcoholics or drug addicts out there that can actually hold a job. Now some might drink vodka for breakfast because you can't smell it, and then maybe have some for lunch, and they have some constant little bit of alcohol in their system throughout the day, but they're very high functioning. There's a lot of people out there. I bet you'd be shocked if you truly knew how many people you came into contact with that have some sort of substance in their body on a day-to-day basis. That maybe is the teller at your bank telling them to earn money, or whatever. Lots and lots of different occupations. Sometimes high stress occupations. There has been very high, well-known attorneys in American Behavioral Health because stress gets to them. They have an underlying anxiety or depression. They turn to addiction and they cover it up for a very long time until maybe they have a breaking point. It's a very common thing. You work in mental health, you'll see people of all walks of life. It's not just like the homeless guy you see on the corner passed out, right? It's all walks of life. So there's people that can very much hold a job. So do they have an occupation? Are they able to work? Or if they're like, well, I've had 6 jobs in the last year, probably something going on there, right? Okay. What would be some clues of addiction? How do you think somebody would act if they're addicted to something? Clues of addiction. What do you guys think? Kind of a trick question. Depends on when they had their last substance. They come into the ER at 9 a.m., they've been drinking, they stopped drinking at 5 in the morning, they probably still have that in their system, right? So they might be calm at that point. Or if they're not truly an addict and they're intoxicated, then you know how they're gonna act, right? We all know what people act like when they're intoxicated. Slurring their words, stumbling around, they can't think straight. But if it's a true addict, they can function very well with stuff in their system, with the drug in their system. So we need to know, when was the last time you took anything or drank anything? What is your drug of choice? Do we ever ask people that? What is your drug of choice? What? IV?
Caffeine.
Oh, caffeine. Caffeine can be an addiction too, right? Very much so. We don't always think of it as, but it absolutely can be. So we don't want to be judgmental, but we can ask them, do you drink? How often? How much? How many nights a week? There's other ways we can ask it. Or do you drink 12 beers a day? Do you drink 6 beers a week? How much do you truly drink? There's ways that we can try to figure that out. Do they have any other injuries or self-abuse, or maybe they're a stumbling drunk and they have some injuries from falling down in the snow. Maybe they come in and they're hypothermic because they passed out coming home from the bar and they laid in the snow at night and somebody found them and they brought them in. They're severely hypothermic, right? So we can look, is there self-abuse? Is there cutting? Do they have any history of mental health issues? Any history of suicide, self-harm? Do they have any visible injuries? So if somebody does come in and we suspect, maybe they're very fidgety, they don't make eye contact, they don't want us to call their family, red flag. If somebody comes in with no support, or you say, can I call your family? No, you don't need to call my wife, or you don't need to call my whoever, right? Maybe a red flag, like, okay, do they know what's happening here? Are you trying to hide something? That can be kind of a red flag. So if somebody has something in their body, when do we want to start looking for withdrawal symptoms? Usually it's 2 to 3 days is when it's become most severe. And it depends on what they're abusing or using. So we'll talk about that when we get to the different things, but usually we have to monitor them pretty closely for the first 8 hours to look for kind of acute signs and symptoms, and then for the first 72 hours. So for the next 3 days, what kind of behaviors are we gonna see? We see them starting to have withdrawal symptoms. Okay, so also if we suspect that they have something in their system, we can do serum drug levels. So did they take some sort of drug? They can do like just a toxology screen that will show if they have any sort of like opioid, any sort of stimulant, what drug or what type of drug is in their system. So we can do toxology testing. If we're suspicious, like they were inhaling like glue or other inhalants, they can do chest x-rays. Those are gonna show like long-term damage. So not something we always do right away. Organ biopsies, obviously if they've died, we would never probably do that in somebody who is living, unless we suspect like severe cirrhosis. Sometimes they'll do like a liver biopsy. Urine, saliva, serum testing, hair testing that will show up for a period of 90 days. What drug is this?
Marijuana.
Marijuana. Yep, so it can stay in the hair follicles for 90 days. So somebody that is using cannabis, we can tell for quite some time. So what are we gonna do for treatment? It depends on what they're using or abusing. There's multiple interventions. We'll get to these a little bit more. We want to get them to a state of recovery or voluntary sobriety. So this is what's very, very hard. People who are true addicts, is it going to be, their goal is, I'm just gonna get sober? Is that a very realistic goal? They have a very high incidence of relapse, no matter where they're at in their recovery process. You can have somebody who was an addict 20 years ago, they are still at a very high risk of relapsing. Because maybe there's some sort of trigger that can throw them right back into that bad behavior, right? We know that there was enough damage done that they can always relapse very, very quickly. So if you're ever dealing with somebody with abuse, a history in their chart, what kind of questions would you want to ask them? What would you want to know? What do you guys think?
How long they've been using.
How long, what'd you say?
How long they've been using.
Okay, or how long they've been sober, right? Now, a lot of people who are true addicts, and if they've gone through any sort of program or therapy, they will talk about their sobriety, because that's part of their treatment, is that they need to be very truthful about how many days they're sober. It's part of their healing process. So even for somebody who's an addict and they don't use for one whole day, they teach them like to tell people, hey, I've been sober for 1 day. I'm gonna make it to day 10. And maybe that's their short-term goal. Or maybe their goal is I'm gonna go 3 days without touching any substance. And then they keep extending that. And then if they relapse, then it just starts over. Like, okay, your goal starts over the day you relapse, that now we're gonna reset your goal, and you're gonna be sober for 1 day. And we're gonna work to day 5, right? That might be just part of their therapy. So it's very, very baby steps. But as their family, sometimes it's very hard, because a lot of times the family starts out as an enabler, and then they get very angry, and then sometimes they give them an ultimatum. Like, you drink again, I'm done. I'm out of here. I'm divorcing you, I'm leaving you, da-da-da-da, right? So if they relapse and that's their last straw with their family, that can actually throw them back into their addiction. So it's a very hard, like, roller coaster. So as a nurse, yeah, we can't be judgmental. We have to kind of, are they able to communicate? People usually who struggle with addiction are not great communicators. They probably don't have great coping skills or never had coping skills. Have they had abuse, neglect, or trauma in their background? What kind of stressors have they had in their life that led to this behavior? So those are kind of things that we would want to assess for as a nurse. And then what kind of goals are we going to set? Because we could give them all these beautiful goals in the world, but until they're ready to truly make those changes toward recovery, and they make that choice, we are never going to change the way they think or the way they act or change their addiction. They have to be the one that makes that decision for themselves. I think that's an important piece to remember. Like, they have to be motivated to change. And sometimes they have to burn a lot of relationships to get to that point. Okay, sometimes we have to be very assertive with them or assertive with communication. And that can be really hard as nurses. Sometimes we'll have the family be the ones to confront them, or to sit them down and do an intervention where you have professionals. So maybe you have mental health counselors, maybe you have addiction counselors, maybe you have cops there, maybe you have an attorney, whoever, that sits this person down and says, you have a true problem, you're an addict, you're going to get help, or you're going to kill yourself. You'd be very assertive with them when you sit them down and do an intervention. Did any of you go to when Angela Kinnicky was here a couple years ago and talked? They did a panel, and it was Big J from the radio, and they had a cop from town and a psychologist here. Were you guys might, it might have been your freshman year, I bet. So Angela Kinnicky, you guys know who she is, right? She's a radio, or what? Yeah, Kelloland, the TV person, whatever they're called. So her daughter OD'd on fentanyl at a very young age. I think she was 19 years old and had a fentanyl overdose in Sioux Falls. She talks about her very bright girl, very artistic, which there is some correlation that people with like left brain, very artistic, very creative, sometimes are more prone to addiction just because of how their brain works. There's a lot of research done around that too, just kind of a side note. So they knew she was abusing, they knew that she was using opioids, she had personality changes, she stopped kind of coming around her family, stopped being around her friends. They could just tell that she was a different person. She'd lost a ton of weight, she looked different, she acted different. So changes in personality, changes in behavior, sometimes are red flags that, hey, there's something going on with this person. So they knew that she was abusing, they tried to confront her, she denied it, they knew this behavior kept on going, and they had planned an intervention with all of their family, with a counselor, a psychologist, and they had police officers there, and they were gonna make her go to inpatient treatment. She killed herself, or OD'd on fentanyl, like 2 days before the intervention was gonna happen. So a lot of times that happens. They might sense that, like, they know they need treatment, but they can't stop, right? They have this dependence and tolerance, and sometimes, like, the withdrawal, like you said, is so horrible that they'll do anything they can to just keep abusing and keep this addiction up, and they don't care at what cost. Like, they know they're hurting their family, they know they're hurting their loved ones, they don't care. Because to them, they need this substance to function. So sometimes make them demonstrate the impact that their addiction is having on others. So this can be very hard. So sometimes in these interventions, they'll have the family members say, like, you don't love me anymore, like, tell me that you don't. Like, they'll make them confront their loved one, which can be very, very difficult. Imagine that. Picture the people the closest to you in your life, whether that's your parents, girlfriends, boyfriends, spouses, children, whatever. It's different for everybody, grandparents, whoever. Imagine if those people were confronting you about your most negative behavior, how that would feel. And then they had therapists, other people there. So maybe your most negative behavior about yourself is that you suffer from some depression. And they sit you down and say, we're gonna talk about this, and you are going to talk about it. How would that make you feel? You might put your guard up, you might become angry, you might have denial, right? You might get really mad, you might leave the room, you might hate your family even more. Or the goal is you might really see how harmful it is to all the people who love you the most, and it might be enough to get them to make a step towards getting help. That's the point of, like, a family intervention or key intervention. It's not always going to be successful, right? But the goal is a tiny baby step that might get them to go in the right direction. So prevent them from denying the problem. So make them say, I'm addicted to this, and I know it's a problem. Sometimes that is a goal. To make them say that, yes, I drink 12 beers a night. I have a problem. I'm using that as an example. I really don't drink 12 beers a night. You guys are worried. Okay? And again, you want them to motivate them to seek treatment. And it has to be a goal for themselves. Like, we could talk to them until they're blue in the face, but if they have no desire to make a change, no matter what we say is not going to matter. Right? So sometimes we have to figure out what motivates them. Maybe they have a kid that they really haven't had much contact with in their life. Maybe they have estranged relationships. And now you're dealing with them in a hospital bed and they're crying and saying, like, my daughter doesn't even talk to me and I haven't spoken to her in 10 years. Maybe there's your motivation right there. To say, okay, why is this relationship not estranged? Why doesn't she speak to you? Oh, because I was an addict and I never showed up to her stuff, or I fought with her mom all the time, or I divorced her mom because I was an addict. Maybe that's your gateway to get to talk to them. So to make them open up and try to give them coping mechanisms if you can. Sometimes that's very, very hard. And as nurses, do we have time for that? Not always. Or sometimes we see them when they're extreme withdrawing and they're out of control, and that is not the time either to have this in-depth conversation and confront them and make them come up with a goal that's going to solve their family's problems that have happened for 20 years, right? Okay, so crisis intervention, this is when they've hit absolute rock bottom. So this is when you might see people in the inpatient setting. Maybe they attempted to commit suicide and now they're inpatient, or maybe they got in their car totally intoxicated and they killed somebody. And now they're in the hospital with injuries themselves, and they're gonna be charged with the DUI and manslaughter. That might be their rock bottom. Everybody's rock bottom can be different. It doesn't have to be this major extreme thing for some people. It can be different for everybody. But sometimes it takes them to hit their rock bottom before they'll ever make a change. So whenever we're dealing with people who are addicted, it has to be them to make the decision. And then our job is to help them develop coping skills. What are we gonna do? How are we gonna help get them treatment? What are they gonna do with this tiny little flash of motivation we see that might be enough to get them to make a step in the right direction? Okay, you'll hear a lot like contingency contracts. So a lot of times you hear this with like Alcohol Anonymous, where they give them chips, like sobriety chips. So this is where we use like positive reinforcement to get them to try to change their behavior. So maybe they're an addict and they don't show up for work, and instead of saying like, oh great, you didn't show up for work again, you're gonna lose your job again, like, it's okay, why didn't you go to work today? Let's talk about it, let's work through it. You're going to go to work this many times in a month and try to work towards going more next month, right? Like, give them some positive reinforcement and like a guide or like a boundary to work towards. Doesn't always happen. They can relapse pretty quickly. So identify expected behaviors. They'll give tokens for rewards. Develop rules for them, or again, like positive reinforcement that can maybe help them work towards that goal. So it might be if they haven't seen their kid or their kid's in foster care, a lot of foster agencies will use this, like you have to be sober for so many days before you can have like an alone visit with your own child. Maybe that's motivation, maybe it's not. So again, what motivates them to reach that? A lot of support groups. So with people who are true addicts, sometimes one-on-one counseling does not work very well. Sometimes they'll use CBT therapy, again, try to change the way they're thinking. We sometimes have to get to the bottom of it, or the root cause of really what caused them to be addicted to the substance. So was it major depression? Was it some trauma from their past that they keep reliving? Maybe they have PTSD. Maybe they're a veteran. Maybe they saw something awful in their childhood and they just can't get that out of their head, so they've turned to addiction as like the Band-Aid fix, right? So sometimes we gotta figure out what the overall bottom cause was, so CBT therapy, to try to figure out what is causing your dysfunctional thoughts, your dysfunctional thinking for you to have this addictive behavior. A lot of times they'll use support groups, right? You guys have seen this on TV. Hey, my name is Stacy, I'm an addict, right? Hi Stacy, what is your addiction, right? So they're in a group of other people who are also addicts. Not always the same addiction, but it gives them a sense of belonging, right? You guys know that when you feel like you belong in a group, you're probably more apt to be yourself, right? And to show kind of your best side. If you can relate to those people and interact with them, you're gonna feel more comfortable. So a lot of times group therapy, where everybody has equal power, they're all in there to share thoughts, ideas, their stories, like, yeah, I was an addict and I did this horrible thing. I'm an addict and I did this horrible thing. And it's not like your horrible is worse than my horrible, but it makes them feel belong, like they're part of something bigger than their addiction. So group therapy can be very effective if people are willing to go to the group. A lot of times they will match them up with some sort of mentor or sponsor. So somebody who has lived through this nightmare of addiction and knows what they're going through and can relate to them. And then their sponsor is kind of like a person that, okay, when you have a stressful day and you want to go to Blarney's and have your 18 beers, then you're going to call me and I'm going to meet you for coffee at Perkins instead, and we're going to talk about it. Okay, so they sometimes have to do group therapy first, find out what started their problem. Do they have any coping skills? Are they motivated enough to make the change? Are they going to be consistent with doing their therapies? Are they going to be consistent in admitting they have a problem? So sometimes admitting, saying that, hey, Stacy, I'm an addict, taking that first step, then they'll be engaged in their group, and then they can be hooked up with a sponsor for more long-term like maintenance to keep them sober or keep them from relapsing. The they'll also use the 12 steps. I'm sure you guys have heard about this. So this, a lot of people like in Alcoholics Anonymous, addiction centers, inpatient alcoholic centers, rehab facilities, they'll use the 12-step program. So they walk through the 12 steps. So the first one, they admitted they were powerless over their addiction, that their lives had become unmanageable. So they have to admit first that they have a problem. That's the first step. And they admit that this addiction has taken over their life, that it's taken over so much that they're not the person they once were. That's their step one. And then they come to believe a power greater than themselves could restore them to sanity. So it doesn't always have to be God. We have a lot of God in there. Some programs will just put a higher power or a higher being instead of God in there, because not everybody believes in God, right? What if you're an atheist and you're an addict? You look at this and you're like, well, I don't believe in God, so these 12 steps are not going to work for me. So a lot of places have removed God out of the picture, and they'll say a higher power, a higher being. And sometimes as nurses, that's really hard if you're a very strong, your spirituality is strong, or you have a strong religion, and there's people who are like, well, I'm an atheist, I don't believe in God, I believe all these terrible things, I deserve them, there is no higher power in my life. So sometimes that's hard for them to work through. But they use these 12 steps as a goal, and part of that is they have to forgive people who they have wronged because of their addiction. And you guys have all seen this in the movies. They have to go and forgive somebody, whoever they have wronged, and it's part of their healing. Because if they don't process through the 12 steps, they're never going to truly reach their end goal, right? So this has been proven to be very effective in a lot of like outpatient settings. The family system is treated as a unit, so again, focus on family dynamics. Who do they have for support? Do they have any support? Have they burned all their bridges with anyone who's close to them? And then how are they going to mend these relationships? So a lot of counseling, a lot of therapy, a lot of kind of building these family relationships back up. If they're a parent and they maybe lost their children because of their addiction, then they sometimes have to go through like parenting classes. Maybe they got pregnant very young, and maybe their parent was never in the picture. Maybe they grew up in a house of addiction, they raised themselves, they got pregnant themselves very young, they don't even know how to parent or how to love or how to nurture someone. So sometimes, as part of their therapy, it's we have to teach you how to be a parent before we can give your child back to you. Maybe it's not totally their fault. They don't come from great home environments, right? Neglect, abuse, trauma, probably somewhere in their past. So establish strict boundaries, improve communication, teach them how to problem solve. They might not have any idea how to problem solve at all. So what else are we gonna do besides therapy? So some drugs. So naloxone, which is what? Narcan. So a lot has been done on Narcan. So if people have an opioid addiction, we can give them a dose of Narcan. So what do we need to know about Narcan? Taylor, you know a lot about Narcan. You did your CAP project on it. So how we can give it different routes, right? It can be given intranasally, which a lot of times communities, that's how they are trained to give it, because they don't have like an IV way to give it, right? So it can be given like nasally. So anytime we suspect that somebody has OD'd on an opioid, we can give them Narcan and it will reverse it. How often can we give it? Remember?
10 minutes.
Every 10 minutes. How many times?
3.
Up to 3 times typically. And you can treat for overdose. So what do we watch for in the patient? Monitor them for respiratory distress. Also, if somebody comes in and they're unresponsive, John Doe, you have no idea who they are, they're unresponsive, you give them Narcan, and they start waking up, you have to monitor for seizure activity. Because sometimes they will seize, sometimes they'll come out swinging. Like sometimes they come out of this Narcan and they're very, very anxious or like very high alert. They might not have any idea how they got to the hospital, why they're there, or wherever you're giving it to. So they might be very paranoid almost. So you might wanna have extra staff there for safety. Monitor for seizures. What else would we wanna check? So you have a Jane Doe that comes in, you're an ER nurse, and they say Jane Doe is coming in, we suspect between age 30 and 40, unresponsive. What are you gonna do as the nurse?
Are they breathing?
They are breathing, but it's like minimal.
Check their blood sugar.
Okay, you would check a blood sugar, yeah? Because let's rule out, is there anything physiologic going on? They might be giving him Narcan as someone else is checking their blood sugar, right? Because it's gonna be an emergent situation, because we don't want him to code. What else would we want to know? What if a Jane Doe's with them? Ask them if they know what they took. A lot of times these people might be dropped at the ER door and the person who's with them thinks they're gonna get in trouble, so they drop them and they run. I've seen this a lot in the ER setting where somebody will just be dropped at the door, they're drunk, they're intoxicated, they're not responding, they've OD'd. People who are with them think like, we don't wanna get in trouble for using, so they leave them there. So you might not have a clue what's in their system. How long does it take to run a toxicology screen? It's not instant, right? If you're in a smaller hospital, sometimes those have to be sent out. Can they do them in
We do,
South Dakota?
we do urine.
So sometimes they'll test a urine, so you might just straight cap them and get a urine sample. See if there's anything right away you can tell in their urine. So if we don't know, they're usually gonna suspect opioids right away. So they'll give Narcan. Okay? So people who abuse alcohol, you can give them a drug called disulfiram or Antabuse. Anyone know what that drug is? Ever heard of it before? Did you guys talk about Antabuse and Pharm at all? So this is a drug you can give to alcoholics. And basically, if they ingest any alcohol at all, it makes them extremely ill, like violently ill. So they have to be very committed to quitting before you can ever give them this drug. So if they don't seem like they're gonna be compliant, they don't give them Antabuse or disulfiram. Because if they take anything, mouthwash that has alcohol in it, they will become violently ill. Start violently vomiting, severe headache, can have shortness of breath. So sometimes they can use this in people who are truly motivated because it does help kind of to decrease the craving that they're having for that alcohol. So it helps reduce the craving, but if they do take any sort of alcohol with it, they'll become very, very ill, very violently ill. So sometimes people's family will know about this drug and they'll say, well, give them Antabuse. Like maybe that will be enough if I make them violently sick to get them to stop drinking. They don't use it in that situation. That's kind of manipulative, actually. The person has to be motivated enough where they're gonna be compliant, and then sometimes they can give them that drug. So what nursing intervention or education would you have to give to somebody who is prescribed this disulfiram? Don't take it with anything that has alcohol in it. So mouthwash, what are other things that might contain a little bit of alcohol? Hand sanitizer, not that you're gonna like ingest it, but if they had some on their hand and if, I mean, they'd have to have a lot, I think, but if they lick their hand or something, they could become very sick with it. Okay, why don't you guys take a break? I see some sleepy